guys, this is Dr. Hub. Today we look at the difference between the cochlear and the retrocochlear loss and the retrocochlear hearing loss. So to begin with, we look at the cochlear and then later on we will be discussing the retrocochlear. So in terms of cochlear hearing loss, first is under recruitment, that is a ABLB test. So this is present, it is present. Next we move on to the SI score. So the SI score, so what is this expansion? It is nothing but the short increment sensitivity index. So here it is about 70 to the 100%. So what is meant by the SI score? So now let's see what is the SI score. So the SI score, first we need to know that the normal ear. So in terms of the normal ear, they can't differentiate the short. So you can't differentiate the short increments. The short increments of sound. So you can't differentiate the short increments of sound. But in case of the recruiting ear, so in case of the recruiting ear, this can. So the SI test, it is started at a sound of 20 decibels. Started at 20 decibels above the hearing threshold. This will be above the hearing threshold of a patient, above the hearing threshold of patient, and 20 increments of 1 dB. So 20 increments of 1 dB is done. 20 increments of 1 dB, they are given every 5 seconds. So it is given every 5 seconds. The total number of increments heard. So the total number of increments heard by patient is recorded. So total number of increments heard, they are recorded. So now when we see the SI score, as we discussed, there is 70 to 100% seen in the cochlear deafness. So 70 to 100% in the cochlear deafness. That is what we are seeing now. So now next, so this was about the SI score. Next we move on to the cochlear hearing loss. Under this, the acoustic reflex threshold. Acoustic reflex threshold. So in terms of the acoustic reflex threshold, there is a decrease due to the recruitment. It is decreased due to the recruitment. Next is the tone decay. The tone decay. So in terms of the tone decay, it is nothing but the nerve fatigue. So here this is absent. So now let's see in the tone decay in detail. So the threshold of the tone decay, so this tone decay, it is a function of nerve fatigue. It's a function of the nerve fatigue. And a tone of 4,000 hertz is presented at the 5 dB above the patient threshold of hearing. Above the patient threshold of hearing. And this will be for 60 seconds. This will be for 60 seconds. The normal ear can hear continuously for a minute. A normal ear, they can hear continuously for 60 seconds. So in case of the threshold tone decay, there is a tone of 4000 is presented at 5 dB above the patient's threshold of hearing for 60 seconds. A normal ear can hear continuously for a minute. Okay, can hear continuously for a minute, but a patient with abnormal hearing, so in case of abnormal, what happens is it stops hearing before 60 seconds. So before a minute, it stops, and the loudness is increased until the patient can hear the sound. So the loudness, if you see, it is increased until the patient can hear a sound, until patient can hear a sound, it is increased. Next is if the loudness has to be increased by more than 30 decibels. So in case the loudness is increased greater than 30 decibels, so this indicates the retrocochlear hearing loss. So this was about the threshold tone decay. Now to continue with our differentiation, next we will look at the acoustic reflex decay. This is under the cochlear hearing loss. So in terms of the acoustic reflex decay, this is nothing but again the nerve fatigue. So here the cochlear hearing loss, it is absent. Next, when we move on to the OAEs, so this is again absent in case of the cochlear hearing loss. Next we move on to the BERA. This is the best test. Here it is a delayed wave, and the rest are normal. So what about the speech discrimination score? So in terms of the speech discrimination score, here in cochlear hearing loss it is reduced. There is a rollover phenomenon. We discussed this in the previous video. Rollover phenomenon, and this will be absent. So this was about the cochlear hearing loss. Now let's quickly go to the retrocochlear hearing loss. In terms of the retrocochlear hearing loss, the recruitment, that is a ABLB test, this is absent. It is absent. Then when we move on to the SISI score, so SISI score, it is about 0 to 20%. Next, the acoustic reflux threshold. This is increased in terms of the retrocochlear hearing loss. And what about the tone decay? In terms of tone decay, that is the nerve fatigue, here it is present. Whereas in terms of cochlear, the tone decay, acoustic reflex, OAE were absent. Here almost everything is present. So the tone decay here is present. Then we move on to the acoustic reflex. This is acoustic reflex decay. This is again the nerve fatigue. This is present in terms of the retrocochlear hearing loss. And what about the OAEs? The OAEs are also present. Next we move on to the BERA. So this is the best test. So here the only wave is present, and the rest are absent or affected. So the rest, if you see, they are absent or affected. So what is the speech discrimination score here? So the speech discrimination score. So this, it includes, it is very poor, as well as the rollover phenomenon is absent. It is absent. So this was about the differences between the cochlear and the retrocochlear hearing loss. We also saw complete explanation on the short increment sensitivity index, that is a SI, as well as we highlighted the tone decay, and we saw the major differences between the cochlear and the retrocochlear. To learn and grow daily like this, please do subscribe.